Patients living in the South Valley could soon get hospital care from the comfort of their homes. Adventist Health taking telemedicine to a new level, rolling out the hospital-at-home model. We spoke to a doctor about how it works. Dr. Gurvinder Kaur joins us now to talk about this innovative way of expanding care at Adventist Health. Dr. Kaur, thank you so much. We really appreciate it. Can you please explain how the hospital at-home program came to be? How does it work, and how will this be helping the patients there in your community?
Thank you. Yeah, thank you for giving us a chance to talk about this program. Essentially, this came about because of the increased surge needs when the COVID hit California. There was a plan to increase the access to hospital beds, and at that time, building brick and mortar hospitals was not something we can do overnight, and so the virtual hospital beds was something that Adventist Health decided to go into to help increase the number of beds available for the patients. And essentially, this is handled through a command center. That is, one of them is located at Hanford, and there are two other that Adventist Health has built to be able to take care of patients virtually at their homes. There are nurses who sit at the command center, and then once the patient is identified in an ER where they might require hospitalization and they have criteria which meets needs of them to be effectively and successfully be taken care of at home. Their information is then transferred from the nurse to the physician, and then the physician sitting at the command center discusses this case with the ER physician, and at that point, if they meet the clinical as well as the social criteria, they are then sent home, and all of the kit from the command center is directed towards their home where they are set up for home hospital.
Now, obviously, I would assume this is not for extremely seriously ill patients. Those patients would be admitted into the hospital. So these are patients that can be successfully cared for at home. Is that correct? And are they hooked up to some type of monitor that is then, continued to be read there at the command center?
That's correct. Yes. Only some patients, such as pneumonia, which is kind of a walking pneumonia, but not something that can be treated with oral antibiotics, or something of a complicated UTI. Some COPD patients, they can be treated in this scenario. We're not at this time, looking at critical patients. However, it has been done in other areas where they have treated critical patients, but that's not what we're doing here. In terms of being able to care for and being monitored at home, that's exactly right. The kit that is sent home has an iPad, has connectivity areas of where they can connect with the blood pressure monitor and so forth, and all of those vital signs are immediately fed into the system that can be looked at the command center.
That's amazing. Are any of COVID patients potentially being cared for this way, or could they be cared for this way?
Currently, we're not doing the COVID patients because there is so much unknown in terms of how their disease progresses during the course of their disease. However, after they are considered to be stable enough to be transitioned home, but they still require some monitoring, that can be considered for COVID patients. But we're not at this time doing taking COVID patients into this scenario.
Okay, and obviously this command center is being staffed 24/7.
That is correct. It's staffed 24/7 with physicians as well as nurses.
Has the hospital seen a surge in COVID patients, or is this just as a precaution, and is this something you'll continue to offer even after this pandemic is over?
This was started as a precaution. We hadn't quite seen the surge at the time. Our hospital here is starting to see, we have had days when we had several COVID patients, but I wouldn't necessarily call it the surge where we cannot handle it. However, this will be continued through the course of next few years. We're wanting to expand it to see if this is the way to improve access for some patients who might not be easily able to come to the hospital, and especially in a scenario where patients are fearful of going to the emergency room or going to a hospital or getting admitted. But they'd rather be at home in the comfort of their home with their families or their pets and their social support system. I think if we can offer hospitalization at home, it just serves all of their purposes as well as being able to give them the care that they require.
Yeah, and for many patients, they are more comfortable at home, so this certainly is an innovative way to take care of them. Our thanks to Dr. Gurvinder Kaur with Adventist Health. We appreciate your time today. Thank you.
Most welcome. Thank you.